In this module, we provide an overview of CHC's Blue Shield of California ActiveChoice Plus PPO medical plan. This plan is available to CHC employees at all company locations beginning January 1st, 2022. PPO stands for Preferred Provider Organization. Under a PPO plan, members may see any provider they wish, but if the provider is a participating provider with the insurance company, then the member typically receives lower billing rates and a better level of benefits. CHC's Blue Shield PPO plan utilizes the Blue Shield full PPO provider network within California and the nationwide Blue Cross Blue Shield Blue Card PPO network outside California. CHC's Blue Shield ActiveChoice Plus PPO plan has 0 calendar year medical deductible. This means that for covered major medical services, Blue Shield begins paying towards bills beginning with the first claim. The member has no amount of claims to pay in full before the insurance company begins contributing. And for financial protection, this plan's calendar year out-of-pocket maximum. The member's maximum total cost for all covered medical bills at participating providers is just $3,000 per year for an individual and $6,000 for a family. Once the member has reached this limit, the member pays no more at all towards covered medical bills in network for the rest of the calendar year. One word of warning: if non-participating providers are seen, that out-of-pocket maximum increases to $10,000 per individual and $20,000 per family. The ActiveChoice Plus PPO plan places medical services into 3 categories. First, there are preventive health services, which at in-network providers are covered free of charge, including an annual preventive care exam. Next, many routine care services are placed in Category 1. These services include doctor office visits, chiropractic, acupuncture, urgent care visits, lab tests, and more. For these Category 1 services, the plan provides an annual credit called a first dollar services credit to use towards payment of the full allowable amount of the service received. The credit amount which Blue Shield provides is $300 per year for employees enrolling alone and $600 per year for employees enrolling with dependents. Once that yearly credit is exhausted, the plan's listed copays for these Category 1 services begins being required for ongoing care. Should a member or family not exhaust the credit during the year, any remaining credit carries over to the new policy year and will be available in addition to the ensuing year's first dollar services credit. Remaining covered services which are not included in Category 1 are placed in Category 2 and are not eligible for use of the first dollar services credit. Let's take a look at some of the plan copays for Category 1 services once the first dollar credit has been exhausted. Once the first dollar services credit has been exhausted, copays are required for most services. Among these, in-network doctor office visits, nurse practitioner visits, therapists, and chiropractic and acupuncture services require a $20 copay per visit. Also, in-network lab services, x-rays, and diagnostic imaging such as MRIs, other than for emergency and surgery, require just a $20 copay. Among the more major services, inpatient hospital stays in-network require a $500 copay plus 20% of the remaining bill. But remember that you are protected by the plan's calendar year out-of-pocket maximum, which is for in-network services, $3,000 per individual and $6,000 per family. Retail prescription drugs purchased at in-network pharmacies are covered with various copays depending upon what category or tier they are classified in. Although generic drug purchases require a flat $15 copay, brand name and specialty drugs require a separate $250 calendar year deductible to be satisfied before being eligible for copays. Should you take multiple brand name or specialty drugs during the year, You will only need to pay that $250 calendar year deductible once for all such drugs, not per drug. Mail order is also available for many prescription drugs, with double the copay required for triple the supply. And your prescription drug costs, including the $250 brand name and specialty drugs deductible, count towards your plan's out-of-pocket maximum for your protection. As with any medical insurance plan, there are limitations and exclusions and additional benefit details beyond those presented here. So please consult the plan contract for a complete listing. On behalf of CHC, thank you.